Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. I've had so many people come to me and say that the vet has now cleared my horse to start work, but although the injury is healed, the horse just still doesn't feel right. Or I've been recommended 6 to 8 weeks of box or yard rest and then we'll reassess. The prognosis will significantly improve with appropriate rehabilitation, which is not always movement of the horse. It can be done when your horse is locked up in a box or a stable. Today we're talking about creating a conversation with your vet in relation to your horse's rehabilitation once you have a diagnosis.
Yeah, so this is a part of your horse advocacy skill set, knowing how to initiate the system of collaborative rehabilitation by having a conversation that acknowledges the need for veterinary supervision, but is forward thinking about your horse's recovery and how you can get the best recovery by bringing in a team.
Yeah, and it's super important that you understand the injury. So the more information that you have about an injury, for example, is it a tendon, a ligament, a muscle? Is it affecting the bone? How long ago did it happen? What caused it to happen? Your horse's general health status, like all of those things are going to have an influence. But then you can create a program where healing and the biomechanics, of the area are actually promoted in your plan, and that you're actually moving towards more optimal function. Like when I do rehab, I actually want the horse to end up being better than it was before an injury, and that the whole horse, like you were talking earlier about a horse where they've done the exercises that you recommended and how the horse is so much better than before when you started seeing the horse, even though you were just looking at kind of whole horse progress.
I wasn't even doing that much for them, but it's what they've done in their own time when they couldn't get out and do, they're not riding and going out and doing stuff, but it's what they did in that time period when they were recovering. It's made all the difference to reducing the injury.
Yeah. And we can't expect an area to heal, especially if it's like a big injury. For example, a ligament rupture, to heal enough without doing anything to build support of the area to then be able to withstand us just letting them out in the paddock, So we've talked about this before many times that, locking a horse up in a yard and then even gradual progression to a paddock is not rehab. You're not making sure that area has appropriate support. Like we don't sit on we've done our ankle. We don't sit on the couch, then start walking around the house, then start, taking little walks and then build back up to running. Like a process, if we've done ligament damage in our ankles, is to do things like calf raises, single leg loading, weight shifting, maybe supported loading in a pool, or, having therapy done on that ankle. Looking at our whole body posture is ideal as well. And that's how we're going to promote loading. I made a mistake once, and I can't remember if I've talked about this, but I did the ligament in my ankle and I heard it go pop. And I didn't wait there for 2 weeks because it was so painful. It was so painful. And then I went to the physio and they said, you will walk out of here without crutches. Well, it took me half an hour to walk out of there without crutches. But yeah, the biggest mistake that I made was not weight bearing on that limb. It doesn't mean that I could do all of my normal exercises, but it means that I was doing as much as I comfortably could. And rehab is not always comfortable, I can tell you that. I've done rehab myself. I've been through, my dad has had things where, he's had to avoid scar tissue occurring in his hands and things, and it's painful sometimes. But it doesn't mean that just because there's discomfort we stop either. We have to understand what we're loading, and by locking a horse up, what we're losing, and also how it's affecting them biomechanically. Because if they're locked up in a small yard and they're only, really walking circles, and say they've got a stifle injury or any lower limb injury, that could just be promoting twist and not stability. And in 6 to 8 weeks of being locked up, they lose, depending what their previous level of strength and stability was, they lose a lot of strength. They lose especially core function, spinal support. And then you start getting muscle imbalances showing up. So you're not only then having to rehab the injury, you're having to rehab the whole body then, because it's been doing nothing for 6 to 8 weeks. And not all vets are trained in functional rehab. They also may not be able to prescribe biomechanics-based exercises. Like, this is something I've learned as an add-on to being a vet. I'm still learning. I'm still studying this. They might not also understand or appreciate the postural influences on recovery and how much that can change loading. And it also really takes time to create and implement a plan and explain exercises correctly. Most vets are not trained in necessarily how to apply the exercises correctly unless they have an interest in rehab and biomechanics, or they just don't have the time to write your plan, and they don't have the time definitely to look at your application of exercises. It doesn't mean they're a bad vet. It just means that their strengths may lie in diagnosis, in imaging, in acute care. And so we just need to explore how we can support our horses after that diagnosis, and optimize their healing, which really the responsibility lies on us, not the vet. We want to work with the vet, create a conversation with them, but you're the one who's going to be doing the exercises. What you do every single day is going to determine the success for your horse. So you need support in that, but you just want to create the conversation with your vet. So yeah, what can, like, when we talk about rehab, so people often just think about movement, but what else is rehab?
So much more than that. It's about understanding, where you're at once you've had your diagnosis. What can the horse comfortably do that's going to promote loading and function of the injured area? Of course, we want it to be creating a functional posture to support the healing and loading. And it's not just about movement. Like you said, it's not just walking or increase yard size. It can be things that you can apply. So that includes laser, red light, taping, neuromuscular electrical stimulation. And some of those are complementary therapies that you would access through somebody else, but it's your responsibility to seek them out either through your vet recommending them, or saying, we're going to actually, asking your vet, what about this? I'm going to seek this out from somebody. How do you feel about their input? And, you might also be doing exercises with the horse to encourage load bearing in the best way that they can. So feeding positions we've talked about and have an episode on, brain games that promote loading in a fun and engaging way, so that you're talking about the fact that you can have a little bit of discomfort. You're trying to reduce the stress and negative experience of your horse as much as possible. That, we want to acknowledge that it's not just like rah, like push rehab, push tissue, because, when you come to posture and loading, often it's the softness of movement that allows you to keep your sort of softness through the body as opposed to become rigid or braced simply because you're forcing an exercise. And, there are exercises that promote body awareness and range of motion, like slowly picking up the legs and placing them down nicely. And so in that exercise, for example, you're not walking. You've got a horse that might be static in a stable or can't go very far. And so through that, you're increasing weight shift. You're also increasing the function of the limb that you're picking up and placing down, because the horse has to softly unload it and give it to your hands. And then they're also loading the other side of their thoracic sling and shifting their balance. And all of that keeps their proprioceptors firing. It keeps their muscles activating. It keeps their brain active for being connected to their body, because when you're not really thinking about your body, and I believe I see this in horses that are in stables, because you're always looking out of the stable, it's like they just spend their life watching horse TV. They're just so externally focused. It's not like, how do I feel? Like you see some horses in the paddock, they're really body focused. And it depends on the horse, but really working with them, what they can comfortably do that promotes loading and functioning for the injured area. So yeah, it doesn't have to require the horse to even walk, but it doesn't mean that we wait until we can walk the horse. So, and that is where this topic comes in that we're talking about today, having the conversation in a way that makes everybody feel like they're respected and on the same page, because as you were saying, not everybody has the same training and not everybody is supposed to. That's why there's different practitioners, because you can access different skills from people. And it means that, any team, we're not just in bodywork and horses, any team needs to have, respectful conversation that is professional and collaborative, so that people are on the same page and that communication lines stay open. How does it, when people have, start a conversation with you, what kind of conversation makes you want to lean in and be collaborative with them?
Yeah, I think if people are respectful of each other is really important. And, it's not personal. So, they are coming with an air of curiosity rather than, you're not doing this or you're not doing that, or yeah, and any of those. Also, just keeping that communication open, and I guess it's really, how you're going to start that conversation with your vet and how you're going to stay respectful. Don't make it personal. Like, don't say to them, well, you haven't given me a rehab plan, or, why don't you know this, or anything like that. It's like recognizing where their limitations are, and it's not that they don't necessarily want to help you. It just might be that that's not their area of expertise. So you could say things to the vet like, I want to support the tissue in the healing phase, as well as like reduce any scarring, because I'm aware that sometimes scarring can cause problems later on. I'd really like to also make sure that any bodywork and exercise that I do, because I want to do something, fits with your recommendations and doesn't interfere with the clinical management of the case. So you're acknowledging their part to play in this, but you're also seeking, their approval of you doing other things. And so, and you could also say, like, I'd like to support controlled loading, improve how the horse distributes the weight to reduce the strain on that area. Like, I can see that they're offloading that limb at the moment, and I'm aware how that can change the hoof really quickly because I've listened to these podcasts, or, I've done a functional posture course, and so I'm very aware of how quickly things can change with altered loading. So, are you able to help me with that, or would you support me getting somebody to help me with that? Do you want to see the exercises that we're doing? Would you be happy to work alongside a body worker or rehab practitioner so that we can support what you've diagnosed? Because I really want to give my horse the best chance of healing, regardless of the current prognosis, I just want to optimize that as best as I can. And I understand how, as much as if we can promote as balanced loading as possible, how that's going to reduce the strain through the injured area. And if you've got some observation skills yourself, you can just not point things out to the vet, but show the vet your level of awareness. So you can say, like, I've noticed how the horse is offloading that limb and how this is creating tension through the horse's back. And, I'd really like to promote the best functional stance that I can as soon as I can to reduce the strain on the rest of the body. You could say things like, is there other things I could do to reduce the heat and swelling in that area? Do you know someone who has a laser? Would that be beneficial in this situation? I was looking at doing this. Would that be beneficial in this situation? And they might say, I don't know, but you're welcome to try. They might say, yeah, I'm happy for you to do any of that stuff. I just don't, have any further recommendations for you. Or they might tell you it's not going to make a difference, but it's not going to hurt. And that's also that's a win, right? Even if they think it's not going to be beneficial, but they say, well, it can't hurt, then you're going to do that. How else could you kind of gently steer things? Like, what other questions could you have with the vets?
If you you should, hopefully we've given people a good amount of insight in this podcast as well, a handful of episodes. There are core themes going throughout. So you can say to your vet what level of movement is appropriate right now. And so that's, it's a bit of a prompt, but it's directed to, finding information about a specific topic. So you've already started to take a little bit of responsibility for one of the categories, like movement. What would you like to see improving before we increase workload? So you might get an answer like, the level of lameness, or I'd like to see that your horse can do, this particular movement, or I'd like to see this amount of motion or this amount of comfort. Another question is, are there movement or positions we should avoid? And so that gives your vet the chance to maybe tell you about the anatomy or the structures that have been impacted, or give you a little bit of advice on surfaces if they have that knowledge. You can also check in and say, I wanted to check if you're happy for us to continue doing these particular exercises. And as you said earlier, this is a really valuable one. If you are not available to demonstrate my exercises, but you can give me a plan, are you happy for me to work with my rehab practitioner? And I would say that's something that I have seen be very useful for people. They get a lot of information that is valuable and directive, but not in a demonstrative form. So having a body worker or a rehab practitioner who can say, okay, I'm going to show you how to do the exercises, and you can show me how you do them so that I can support you so that your work is effective. And these kinds of questions close the gap, but they don't directly call anything out as, you're not putting anybody on the spot. It's simply, what information do you have for me on this topic? And in that instance, when conversations are collaborative, people are always more likely to say, I'm not sure, I might check because I'd like to know as well. That's not something somebody's asked me. Or I'm not sure, but there is somebody I know of who could support you doing that. And another consideration that we wanted to point out is that these recommendations take time, and your vet needs to be paid for their time, and they also need to have the time available, because we all recognize that there's an industry issue of overworking, over-expectation of veterinary service. And just because people have decided to dedicate their life to a profession doesn't mean that they need to go over and above what would be typically given in a job. So these recommendations take time. You can ask a question like, can I please book a time with you to have a deeper conversation about the recommendations for rehab and exercises that my rehab practitioner and I have come up with? And that will give you the opportunity for them to say, yes, I can see that you respect my time, and I can make, a time here to have a conversation, or we can have another follow-up appointment to discuss that. And that's a great collaborative way to be respectful.
Yeah, or the vet might also say, like, they might look at the exercises on paper and be like, yep, like, they're fine. I don't need to have another conversation, with you at this time. Like, I'll just come back at the 6-week checkup, and I'm happy with that. Like, I think the biggest thing that you highlighted there is you don't want to add to the vet's workload. So they often don't have time. Like, they've got to write up some notes, but they often don't have time. Like, for me to write a rehab plan, and that's with my rehab knowledge, it takes me at least an hour. Plus, having looked at x-rays, reviewing the case, that's another hour. Plus having a conversation with the owner and then explaining what I want done, that's at least another hour. Vets are lucky to have an hour to spend with your horse. And so, recognizing that they're not going to want to go home unless they have an interest in rehab. They're unlikely to want to go home and write you up a plan, or they're unlikely to want to go home and spend a whole lot of time reviewing things for you. So it's not that they don't want to do it. It's just that they're trying to balance life, mental load with work, and they have another call after you that's an emergency. So we want to position whatever conversation that we have, we want to position it that we're supporting them, we're not replacing them, that you're just trying to optimize the progress for your horse, and you're willing to outsource that. But you also want them to be a part of the conversation if they want to. But if they do shut you down, then I guess it's kind of saying, well, I'm going to progress with this. Is there anything that I should definitely avoid? Because I'd really like to give this a go, regardless of whether you believe it's going to help or not. If you think it's not going to do any harm and you're happy for me to give it a go, then, are you happy with that? So, and the ways that you could also do that, if the vets want to have a little bit more involvement, is that you could have videos of your horse doing the exercises, or videos of the exercises that you're thinking of doing. So you could say, this is an exercise I'm thinking of doing, say carrot stretch, chin between the knees. Will this be okay for my horse to do? And then they're like, yep, that's fine. Or, do you think my horse is comfortable enough for me to pick up their legs every day? Like, that can be an exercise in itself. The horse is often walking around uncontrolled, doing twists and turns. And if a vet says, I don't want them to move, well, they're already moving in a not so great way. You could also make sure that you have photos and videos of what you're doing and show how your horse has progressed. So you could say, like, these are the exercises that we're doing now. Are you happy with them? You could have them written down, and if they want to see a video, you've got a video. And also make sure that your skills in observation, you're always improving them. So, because the more information you can give your vet, just saying, what exercises do you give me, is not helpful. They don't have time. But if you say, I'm thinking of doing this, are you happy with that? Like, I'm thinking of changing their feeding height just to promote a bit more loading on that limb as the horse gets more comfortable. Are you happy with that? And they're like, yeah, I'm happy with that. And then I was thinking of, moving the height a little bit creating, putting the horse on a mat while I feed them. Are you happy with that? It's not going to cause any problems with the current injury. And they're like, yeah, I don't see that's, might help, might not, but I'm okay with it. So, and then you could also create your observation skills and say, I noticed when I did this that the horse started to load better. So it's creating that conversation with your vet. So they're involved as much or as little as they want to be, but they don't feel like you've, just taken over the case. What about though, so if like sometimes it can be really hard when you've tried to be diplomatic and, tried to discuss rehab with the vet, but it's just you're not feeling stuff is not going wrong. Like what are those situations?
So, those kind of situations when you feel like you're coming up against a block are often when you might find that the horse is not improving. So you kind of feel like you're really not getting anywhere. Or you might have listened to this and still be in a position where the plan is box dressed only with no progression, and maybe you've tried to have a conversation. There is ongoing compensation or deterioration is another one. You're starting to see changes like your horse's muscle mass is really deteriorating, or you can see they're really getting quite uncomfortable and very stiff.
Or the feet are changing in a negative.
Yeah. Yeah, you're having, the capsule is starting to distort, or, just different things. Firstly, I think it's reasonable to acknowledge your own, how you feel, because it is emotionally charged. When you care about something so deeply, you're always going to feel it keenly. And it's important at that time to not become angry or aggressive or abusive, to yell or to get angry. It's your responsibility, if somebody can't meet your need, to go somewhere else or to have a more direct conversation to say, I need more support, or, I want to try something else, I'm going to do these anyways, etc. And sometimes that can take a little bit of courage, and it's worth acknowledging that, because sometimes these are uncomfortable conversations. It's not just like, have this conversation, have that conversation. It can be scary. You can feel like a pain in the ass. You feel like you're bothering somebody. But, to find the courage to say something like, hey, I'm concerned we're not seeing improvement. Would you be open to adjusting the plan or incorporating more guided movement? Something like that opens the door for, why aren't we seeing improvement? And to go back to our earlier question, where do you think my horse should be right now? And what would you like to see before we graduate? And understanding, okay, well, like, here's my timeline and I'm staying on top of it. We're not really getting to the point we need to be. And so you might still come up against cases where you're going to be dismissed by your vet, or they're unwilling to collaborate or have conversations with your rehab practitioner, or it feels like they're actively blocking progress. And, you might be in a situation where the vet is unwilling or unable to support you in the way that you'd like. And if that happens, it's reasonable to find a second opinion, find a vet with rehab interest or experience. I know you do online consults, and not all partnerships are the right ones, and that's okay. And then it's just time to decide, where am I going to go from here? What action am I going to take to find the support that I feel that I need? And sometimes people just aren't a good fit as well. It doesn't necessarily mean somebody doesn't want you to progress, or, or that they are being dismissive. If you feel like you're having a hard time with those conversations, or it just feels like it's really hard for you to either understand what they're trying to tell you, or you really don't like the advice as well. Sometimes you feel like somebody is putting in a lot of effort and they're really forthcoming, but it's not the right advice for you. You are valid in finding a second opinion, even if you find out it's the same opinion someone gave you. If you need that reassurance and confidence, you are within your rights to go and find that information and continue to search for answers for your horse.
Yeah, and one thing I'd also say is that in terms of, where you want your horse to be before you progress, like, it's a good question to ask the vet, but also just recognize that often their basis of a prognosis is based on minimal rehab often. For example, if they've been involved with, say, I don't know, ligament tears in the stifle and they tend to never go well, or they've been involved with, injuries that historically the prognosis is quite poor. Their frame of reference of that is very different to being involved with those injuries with an intensive rehab program. So, for example, post-kissing spine surgery, like what this is, kind of getting into a whole nother realm, but for example, post-kissing spine surgery, doing nothing for 2 weeks versus starting rehab day 1 is going to give you long-term a extremely different prognosis, like chalk and cheese. So say vets have only dealt with number 1, where their rehab has not been done until 2 weeks, or say they've only dealt with situations where the horse for that injury has always been box rested for 6 to 8 weeks. Their measure of progress and outcome is based not on implementation of a rehab plan. So their prognosis might be, or their expectation might be, that the horse is weight bearing after 3 or 4 weeks, say. But in a rehab plan, the expectation would be it's weight bearing next week, because of the exercises that you do. So just to be aware of that difference in progress, because it's not, and vets often need that to be proven. So it's not until they come and do the follow-up scan that they will say something like, oh, gee, well, this was healing really well for 6 weeks. But they wouldn't necessarily have had enough experience with horses doing a rehab plan versus horses not doing a rehab plan to have seen the difference in healing times. So their expectation is going to be based often around a horse that's not doing an intensive rehab plan, if that makes sense. Like, I used to be involved I used to treat a lot of dogs. And the good thing with treating a lot of dogs is that there's a lot more rehab being done in dogs. So they get cruciate surgery, and their good rehab begins the next day. Right? They are expected to weight bear the next day. But in the old days, if the dog still wasn't weight bearing after 3 weeks, it would still be considered okay. So because they didn't have intensive rehab programs back then, and there was different surgeries and things too, but, knowing what good rehab outcomes are creates a difference in expectation, if that makes sense. And I've been involved with people who've had extensive injuries. Like, one that comes to mind is a student of mine where the front leg of the horse up at the forearm was like huge, like the muscles were like completely obliterated, and that horse would not have wanted to weight bear. But so she was an equine science student, and she was also, this horse was one of her pride and joy. She was doing the functional posture course. She'd also worked with a lot of vets. From day 1, she called me or showed me the photos and was like, what can I do from day 1? It was like, feed this horse in a position where it weight bears as much as possible on that leg. Then, progress to this, and this. It was not going against any veterinary care. We weren't moving the leg. We weren't promoting extra inflammation. We were very aware of how severe the injury was. And the last I saw of that horse, she was in our course, and it obviously still had a deficit because it was a big chunk of muscle taken out. But, they were preparing that horse to be started as a racehorse. That horse, if they had have just left that horse to its own devices, just being locked in a box until that injury healed, we would have probably ended up with the problems in the neck because of the offloading of that leg for however long. So the number one thing to do, regardless of whether your vet is on board or not, is promote loading in the limb. Like, if you can promote loading in that limb from day 1, you will prevent muscle loss. And that can be from a feeding position. That's the easiest way, but promote loading in that area of the body. Even if it's a fracture, unless it's unstable, we want to promote as much loading as the horse can do from, day one. So, yeah, what would your kind of takeaways be?
That creating a conversation with your vet can lead to better outcomes and is worth doing. And also that, the responsibility lies with you sometimes in both creating the conversation and asking the right questions and being thoughtful about it rather than it being an offhand part of your time. Considering what your horse needs is really worthwhile to be, what kind of questions am I going to ask? How can I keep good records and bring them to my vet so that it makes it as easy as possible for them to make decisions or give me advice without overloading. I don't expect them to carry the weight of, asking me all of the questions, and, bringing things to them is going to increase outcomes for your horse. Definitely work with a rehabilitational or functional posture practitioner. So this means somebody who can make observations about how your horse is and isn't loading to support you to kind of edge into improving both comfort to allow you to get as much as you can done well as early as possible, like everything you're talking about. And also so that they can help and remind you to how to do the exercises effectively, because the more effective your exercises, the better your outcome's going to be every time.
Yeah, but understand that they may or may not be able to see that depending on what their eye is honed in on. Like, they might be more focused on diagnostics and the ultrasound showing improvement, and so that's great. If the vet can't see it biomechanically, that's okay as well. Like, so, you can ask them, for example, is this exercise okay to do? That's a fair question that I think any vet can answer. But if you maybe ask them to talk about the quality of the exercise, that's probably more for your rehab practitioner.
So that's what I meant. Working with. Yeah, definitely.
So asking them, is this exercise okay to do? And then working with that quality with the other practitioner. I think my takeaway would be recognizing that the value of the vet in terms of progress and diagnosis, and I guess worst case prognosis is valuable, and then including them if they want to be, if they're open to be including them as much as they want to be included in the conversation, and exactly what you said, making it as easy as possible for them to be included. So you're not saying, can you create me a rehab plan? You're saying, okay, is this your recommendations, like bute and rest for 6 to 8 weeks? Would you be open to, or not even that, like, would you be happy if I explore other exercises I could do in that time? Do you want me to check them with you? Because I would really like to optimize my horse's outcome as much as possible and reduce the scar tissue, promote healing. And are you happy if I seek out someone to help me with that rehab plan? And then how much do you want to be involved with that? So do you want to check my exercises? Do you want me to run it by you? Or do you just want to tell me now the things I can and can't, like the things that you would say a definite no to? And I'll make sure that the things that you say a definite no to are not included. For example, if the vet says it's a definite no to take them out of the yard, it's a definite no to expect them to stand on that limb. It's a definite no for trotting. So then you'll go, okay, that's my definite no's. There's a lot of stuff you can do without doing any of that. So you just got to ask your vet how much do they want to be involved in it, and how much, are they happy for you to do and to not do.
Yeah, and what a great position we're in to be, the more that people collaborate, the more awareness that comes to people wanting this from vets, the more that there will be circulating information and thoughtfulness about what conversations are people going to ask me about and what am I prepared to tell them ahead of time. So, the more we ask these questions, the better answers we get, and the more receptive you are to the answers that you get, the more you're going to get them as well. So that's going to improve the relationship between your posture practitioner or your body worker and your vet over time, because we're going to have more interest from vets, or just it's going to become more of a core part of their role.
More accepted,
and more accepted to have interest. And we're at a point now where that is definitely happening, and that's a good thing for horses.
Yeah, and to just be respectful of where they're at. Empower yourself with being able to recognize functional posture and to have those observation skills for your horse. Like we talk about that so many times, that your observation is your superpower. And so you can discuss your observations with the vet, and they might be things they didn't think about, and so they're like, oh yeah, I didn't think about that. But also, not to feel like you're not supported. And like, I do offer online consultations. I've got a couple in my inbox at the moment from body workers wanting support to create a rehab plan for their client, and horse owners that want to create a rehab plan for their own horse. And they bring me the diagnostics. I look at them from my perspective. I can also tell them conversations to have with their vet. Oh, that's what I was going to say. Ask your vet if they want to just have the conversations with you about the rehab, or would they like to speak to the bodywork or rehab practitioner, as well? Like, would they like them to give them a call? Because it's better if the body worker calls them rather than them having to call the body worker. But, if you could say to them, would you be happy for my rehab practitioner to give you a call, or would you prefer that, I just work through me? How much input do you want to have, kind of thing, in this conversation? Awesome. Well, I hope that that's helped you kind of recognize that rest and 6 to 8 weeks rest is not rehab, and that I hope it empowers you to know that there's other things that you can do. And I hope it empowers you to have a conversation that's very conducive with your vet. We'd love to hear about that. So thank you for joining myself, Dr. Raquel Butler, and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights. Reach out with any listener requests for topics you like us to talk about. And if you're a business that's aligned with our mission, then reach out to become a sponsor of the podcast.
And we will see you in the next exciting episode.